What's up, everybody? Welcome in. I see we got a few people here. Roel, what's going on? Mark from West by God, Virginia, what's going on? Great to see you. Who else we got? We'll let a couple people come in here. Thank you guys for being with us tonight on the Performance Medicine Show. We do this every single week, Tuesdays at 7 o'clock. Gosh, last week we did Monday, so it's nice to be back with you guys on Tuesday. We tend to, we want to make sure we get it in each week. So thank you guys for being flexible with us last week. And I think we're live everywhere, I believe. I think we're on Facebook. I know we're on YouTube, and I think we're on LinkedIn. Welcome in, everybody, to for you who are coming in just recently. Welcome. We're going to be answering questions here shortly. Stan, what's going on? Thank you for letting me know we're okay on Facebook. Stan has confirmed we are live on Facebook. All right, rock on. Today we sent out Performance Weekly. As you guys know, we do this every single Tuesday. Velma, what's up? You made it? Yes, thank you for being here, Velma. This week we had a bunch of videos go out on the YouTube channel. We send a curation of all of our content on Performance Weekly, which is a weekly email. This week's Common Sense MD episode, some of you may know, is on HMB, hydroxymethylbutyrate. And there is an adjacent notes article that went with it that kind of goes over some of the highlights, things that we found super important, that we think, things like dosing, what it's for, who it's for, those sort of things. So we found that watching or listening and going over the notes is like probably the best way to spend those 10 to 15 minutes on the Common Sense MD. But with HMG, the big thing I took away is it decreases muscle breakdown. So like as you age, you lose muscle, and HMB slows that process down. And you guys can ask Doc about that. He's really into HMB right now. So if that's something that's interesting to you, definitely bring it up during the show. On Dive Into Diet, the star of the show, Lucas Schmidt, our nutrition coach, talks about progressive overload. I'll be honest with you. I've been working out my entire life, and I didn't know what progressive overload was. All my tennis friends and workout friends would be upset with me, but I didn't understand it. Lucas breaks that down for us and tells us how we can add progressive overload to our workout routines and when it's important to. Let's see here. I'm seeing a few people. Grandma Mary, what's going on? Great to see you. Spencer, what's up? Thank you for that question, Spencer. We'll definitely get to that over on YouTube. Let's see. We had the diabetes tour guide. Here we go. On the diabetes tour guide, my brother, Andy Rogers, the host of the show, talks about hypoglycemia. What is low blood sugar? Why does it happen? And how can you stop it? I really think it's obviously a show around diabetes, but I think anybody interested in their health should be following that content. It's it's laid out very well. The videos are super well edited. Shout out to my mother, Jenny, as well as Zach, our video editor. They do a great job of educating through the visuals on YouTube. And we're getting ready to be up on all the audio platforms, Spotify, Apple, etc. So be on the lookout for that. Let's see, we're getting Doc in here. Good evening to my brother, Steve. What's going on, man? Great to see you in here tonight. Hope you guys are having a wonderful, wonderful evening. Let's see here. What do we got? You guys know we're going to be doing this the next couple weeks. We have Black Friday coming up. This is where our biggest discounts of the year happen the week of Black Friday. So if you're a patient or want to be a patient, or if you're close to one of our offices, they're our deepest discounts. So these are for the Tri-Cities. And then we have these for our Knoxville area clinics in West Knoxville and Fountain City. We will be posting this, kind of sporadically through the evening, so you guys know what's happening that week of Black Friday. It's one of our favorite weeks of the year. We get we rally all the troops. We get everybody together. We're answering phones. We're helping out as many people as possible. See, Carter's pumped. It's Katie's favorite week. We're all going to have a blast that week. It's the week of Black Friday. Entire week, those specials are good, and you can order over the phone, so you don't have to come into the office. All right, let's see here. Thank you, Roel, about the video series with Andy. He's doing such a great job with that. We just filmed, another 3 episodes last week, so we're pumped to get those out. Let's see here. Is Doc ready to roll? He's ready to roll. All right. What's going on, man?
Ben, how you doing?
I'm wonderful. I tell you what, I've been really enjoying this weather. I know the time change is weird and it's dark out, but man, this weather has been phenomenal.
This weather is fantastic. I took 2 walks today at lunch and right after work, and it was fantastic. I love it.
It's amazing.
Having a good evening. I'm sitting here drinking my elderberry tea, which I made.
Look at that.
Fresh. It's fantastic. Thank you, Mama Bear.
All right, Mama Bear with the elderberry. I love it.
Yeah, really good.
I love it.
Yeah.
Why do you like elderberry? Is it just kind of soothing at night? I'm trying to. It
tastes good too.
I like to have a beer at night, and I'm trying to replace that with like
you shouldn't.
a tea.
Yeah, you shouldn't do that. You're gonna get fat. You know that.
I know. I need to fix this. Jay Jenkins, what's up? We're definitely gonna get to that. Evangelon, thank you for being with us live tonight, man. So good to see you in here. He's listening from work. Lisa, thank you so much for sharing. That means the world to us. All right, we're gonna get to some questions, Doc. You ready to roll?
I'm ready to roll. I did have an interesting patient I'll tell you about today. A new patient came in and said that he was worried because he couldn't remember anything. I mean, he could not remember. He thought maybe he's getting dementia or something, and he couldn't remember what he had just said, etc. He says, "Doc, what do I do about it?" I told him to forget about it. That was an easy answer. That was a joke. That was a joke I heard today. I thought it was kind of funny.
I thought that was hysterical. Like normally, I know Katie, Carter, myself, we don't always find your jokes hilarious, but that one was good. That was a good joke. I like that. I hope we got some people here live with us tonight. I hope you guys found that hysterical. Joe Colby, I'm gonna put this up. I'm all about the Athletic Brewing. That's a non-alcoholic beer. I'm actually going to have one of those tonight. I like the hazy IPA. So thank you for putting that in. It's like, it literally tastes like beer, but no alcohol. I love that.
That's becoming very popular.
It is. It is.
I think it's a good thing.
All right, guys, y'all know the drill. If y'all have a question for Dr. Rogers, go ahead and put it in the comments. We're going to get to questions tonight and go till 8. Let's get this one in here because this, we talk a lot about supplements, and I'm sure a lot of people in here feel the same way. All right, after adding new supplements over time, I just want to confirm that taking all of these things together at lunchtime is not causing any to be ineffective. Goes on to say, I do this because it is the only time of day that I know I can consistently take them with a meal, life extension, until they can get the Dr. Rogers formulas. Here's what they are taking. It's vitamin C with quercetin, multi, EPA, DHEA, which is the omega-3s, vitamin D3, K2, NAD+, curcumin, saffron, CoQ10, B12, sublingual. So these are all being taken at lunch. What's your thoughts on this? Is there a better way for them to do it?
Yeah, I think it's fine. You're going to be fine. I like the ones you're taking. All those are really good. I'll certainly take all those. But yeah, you know, because I don't eat breakfast anymore, um, and I feel a lot better when I don't eat breakfast, and it seems to keep weight off of me. But you know, I'm the kind of guy that needs to put on weight, not lose it. So I've always been a hard gainer. But yeah, I mean, if you can split it up into twice a day, some people say that's maybe better, but certainly none of those are going to interfere with each other. So you're fine with that. Like somebody asked me the other day, what's the best time to take creatine? You know, we just got our creatine, our own white labeled creatine in yesterday, and which I like. But what's the best time to take it? Daily. Just remember to take it. So I think that's the main thing. And certainly, you know, with your multi and the fat soluble vitamins, you need that with food. So that's fine. I like what you're on.
I'm gonna put this up just for the folks with us live. This is actually brand new. I think it came in this week. Katie, you can correct me if I'm wrong. But yeah, we're super pumped about the creatine. These the Dr. Rogers formulas are in full force in the offices, and like we've said before, we're working to get those online. Most likely going to happen after Black Friday.
I think on the next batch with that creatine, I'm going to put in HMB with it.
Yep.
And have a combo for muscle building. Look at my podcast from today on HMB, and it's those two together are very synergistic. If you work out a lot, and you want to build muscle, so and they're safe. So
you described HMB with vitamin D with K as like acting like a fat burner, and I found that really interesting. And it's like it's not a weight loss supplement; it's a muscle building supplement, which you know. How do you build muscle, which gets rid of fat, which is kind of cool. I'm right with that, right?
Yeah, muscle burns fat. The more muscle you produce, the more you increase your metabolism, and it burns fat. So,
all right, we're going to keep going here. This is a question that came in through email, and I don't know what T2 is. But I'm going to ask you this. It is, what are your thoughts on using T2 supplementation to alleviate fatigue in individuals with thyroid disorders? What are other issues does it help with? I know you see thyroid every day. What's your thoughts on this?
Yeah, you know, that's just one of the thyroid hormones that is out there. Nobody really hears much about T2. Actually, when your thyroid puts out several different kinds of thyroid hormone, is what it is, and this is one not many people even hear about. But your thyroid actually puts out T0, T1, T2, T3, T4. And it just really means how many iodine molecules are attached to the thyroxine on there. So the one you think of people using most of all is Synthroid or levothyroxine, generic Synthroid, and that's T4. Well, T4 is really not an active thyroid hormone. It has to convert to T3 to become active in your body. So that's why we use a lot of T3 by itself called Cytomel, and we use a lot of Armour and NP thyroid, which are actually desiccated pig thyroid pills. And those have olive in it from T0, 1, 2, 3, and 4. And that's why I think most people really like them much better than using Synthroid or levothyroxine. At least 90% of my patients, when I switch them from Synthroid or Levo to something like NP or Armour, they just feel better. At least 90%. But it's, you know, it's old timey. It's not synthetic. You know, they push in synthetics on us all the time. But that's certainly what I would take, and I put most of my patients that have underactive thyroid on, is a desiccated pig thyroid supplementation that has all the T's in it. Now, T2 is kind of interesting because a lot of people put it in over the counter in some of these weight loss supplements. They put some T2 in there. And it is an active form of thyroid, but not nearly as active as T3. So you have to use a lot more T2, to get the same effects as the T3. But some people think it's better for weight loss and stimulating brown fat metabolism and acting on the mitochondria a little bit better, which is your part of the cell that produces energy, ATP. So, it's in a lot of these weight loss supplements, and they claim it works. There haven't been a lot of studies with it. So, where you get, I don't know where you can get just plain T2 by itself. You can probably get it somewhere, but certainly it's not as active as T3. But there may be some great uses for that in the future. They're kind of starting to work on it a little bit. So, but I do think that's why something like an NP or Armour work better than a synthetic T4 prescription medicine. So keep your ears peeled about T2 supplementation, because some people say it's great and may even have some other benefits, mainly energy production and weight loss. That's why they'll sneak it in some of these weight loss supplements that you get over the counter. But really interesting thing, it just has 2 iodine molecules on it, and it does have some bioactivity. So stay tuned for that one. A lot of research right now on weight loss for that.
So we will we'll keep you guys posted on what we're learning about T2. Thank you so much for that question that came in through email. Kind of spurred that conversation. We'll talk more about it. I'm going to put this up from Evangelon here. You should throw some berberine in with the HMB creatine D3K formula. That's cool. I like that.
Yeah, berberine. I love berberine. I started my last patient day on berberine. And it wasn't the guy who couldn't remember anything. And I told him to forget about it. It's a lady.
Now, I want to get to this next question, because it actually has to do with the desiccated thyroid medications. And we've gotten, a couple questions around, when you're already on something, can you also take tirzepatide or one of the GLP-1s?
Sure.
This question for the people listening is, while on desiccated thyroid medications, can you also be on tirzepatide?
Yeah, you sure can. Yeah, that's not going to interfere at all. There's some question about, use of tirzepatide, which is Mounjaro, or Ozempic, which is semaglutide, as far as absorption of some medications, because it definitely delays gastric emptying. So that's possible. But so you always, if you get on one of those and you're on a thyroid medicine, just check your levels in a couple of months to see where you're at, see if it affected it at all, because it certainly can. And of course, you're going to take your thyroid medicine on an empty stomach anyway. But what I would say is, just don't take your shot. It's a once a week shot. Don't take that right around when you take, within several hours of taking your thyroid medicines. What I would say.
So just wait.
Yeah.
Okay. I love conversations around that, because I know a lot of people are taking different things and they want to know that, that separation. How long?
That's a good point. It's a good point, because it can affect your uptake of medicines and vitamins. So I just tell people to don't take the shot right around when you're taking some of the other medicines, especially something like a thyroid medicine.
Okay. Thank you so much for that question that came over on Instagram. And say hello to Angela. I see your question. It's a great question around methylene blue. Lisa, what's going on? Coal miner's daughters in the building. What's going on? Great to see you this evening. We got another question that came over on Instagram, and this is, if your cholesterol levels are good and in range, but your LDL is high, is that a concern?
Well, it just depends. I told a patient today that, had one of the best lipid panels you'll see, but her cholesterol was 220, and her family doc wanted to put her on a statin. But when you broke it down with a Cleveland panel, her HDL was 93, her LDL was 80, her ApoB was 80 or 75, her particle size was great, triglycerides were low. There's no way, and her LDL was not oxidized. And her inflammatory markers great. There's no way I would put her on a cholesterol medicine. That panel was actually better than my panel. My cholesterol is like 160, I think, or less. But so the LDL, the quote, bad cholesterol, really, when you get a total cholesterol, an HDL, and an LDL, which is what most doctors will get, you really can't, that didn't tell you much at all, to be honest with you. You need the particle size, you need the oxidized LDL, you need something called an ApoB to look at it further. So, the LDL is, quote, the bad kind, but to be honest with you,
just
you
that
gotta look at
one thing alone.
all the other risk factors as well. But yeah, and I suspect your LDL is not that high. If your total cholesterol is good, your LDL is probably not going to be that high.
And I want to put this up
unless
from
your HDL is really low, but could be. But
say that
your HDL, unless your HDL is very low, you want to get your HDL up. And remember, statins do not raise your HDL, the good cholesterol, they lower it. That's another reason I'm not fond of statins for everybody. A lot of docs just slap everybody on statin. I don't agree with that.
So if your LDL is high, but your HDL is also high, that's not as bad. So because you want your LDL, your HDL up.
Yeah, right.
I'm going to put this up from Coal Miner's Daughter just because it's exactly what we're talking about. In the same line of questioning, if triglycerides are high but total cholesterol is good, then what is line of treatment?
Yeah, that's a great question, because really triglycerides are more damaging than cholesterol usually. And what I would do for that, it's completely different treatment. Of course, diet, what kind of food you're eating is real important. The bad fats and the high bad carbs are what causes triglycerides up. Now, there are some genetic conditions that you can have hypertriglyceridemia, but usually the treatment is omega-3s, and that, which is over-the-counter fish oil, krill. That'll bring them down most of the time. I rarely have to use anything like fenofibrate. Sometimes I'll use that. There are Lopid. There's some medicines that we sometimes use, but try the omega-3s, which to me are so important anyway. Very important.
All right, Coal Miner's Daughter, thank you for putting that question in. We're going to get back here to, let's see, where are we at? Okay, so this is another vitamin question around, maybe some overlap with multiple supplements. Question is 3,000 mcg of vitamin A in the super vitamin plus another 630 mcg in Happy Healthy Hair. Is that too much vitamin A?
No, I certainly do them. No, I think you'd have to get over 10,000 micrograms to even worry about it. So no, I don't think so.
All right. I hope that helps. And we're going to go to another one here. What about taking the super vitamin, which is one of the Dr. Rogers formulas, plus Dr. Rogers D with K2? That is 180 plus 180, 360 micrograms of K2. Is that okay?
No, I wouldn't do that. All you need is 180. So if you're taking the super vitamin and you need some extra D, take the plain D3 without the K.
Okay.
It probably wouldn't hurt you, but I just wouldn't do it. You don't need more than 180.
I think that is a common question. I've actually thought about that myself. Yeah. If you're taking,
it's a great question. Just like example, when somebody has COVID or they're sick and we pop their vitamin D up to 50,000 a day for 5 days, which is safe. Just, do the plain D3. One of them, you need 180 micrograms of K2, MK7. But when you pop it, make the rest of them with just plain vitamin D3.
All right, so I'm hearing you're fine with the D going pretty high, but keep the K2 at 180. don't overlap those if you can.
Yeah, right. Probably wouldn't hurt, but I just think it's better part of valor just to take a total of 180.
All righty. Thank you so much for that question. And I believe that does it for the ones that came in over the week through email. Thank you guys so much for helping us start off the show in such a positive manner. Those questions were amazing. We're going to go to the live comments now. So those who are with us weekly, you know the drill. If you have a question for Dr. Rogers, go ahead and put it in the comments. We're going to get to as many as we possibly can. Let's see. I just think this is funny. Some guy came up to my car and asked if I wanted to buy hydroxymethylbutyrate.
That's hilarious.
I'd say no. I'd say that's not a good place to get it from.
No. Who knows what it was? It could have been, who knows?
Let's get to Spencer here. Any suggestions for someone with stage 3 pancreatic cancer when doctor says chemo is not working? Spencer, man, my heart is out for you or a loved one right now. What's I know you get questions like this in office. What's your thoughts on this one?
Yeah, the things I would do besides the traditional stuff, I don't know if a Whipple surgery is amenable for you. It depends on if it's the head or the tail of the pancreas. But if surgery's out, chemo's not working, and here's something I would do anyway. Number one, I'd get on a ketogenic diet. I would take IV vitamin C, and I would get on fenbendazole. Go look at some of our podcast on Fenben, and I'd probably get on artemisinin. So those are some things I would definitely do. If it was me, I would get on those.
All right.
And always get a second opinion, from it.
Thank you for that question, Spencer, and keep us posted if you need any more information. Let us know. We've got a couple of videos on Fenben and artemisinin and a lot of those types of things. If you have any questions, don't hesitate to put them in the comments tonight. Let's go to let's see where we're at. Let's go to Richard over on Facebook. Friend started a supplement from China and developed AFib. FM Doc said it was China supplement. AFib resolved 2 days later. FM Doc recommended same supplement from New Zealand. No AFib after 1 year. Are you concerned about using supplements from China?
I am. Yeah, I am. It's just a fact now that you got to be careful. It may have been an omega-3 fish oil supplement that has been linked in some cases to AFib. So if you have AFib, I'd probably cut my omega-3s out, even though they're great for a lot of things. There's a lot of recent data that you may have an increased chance of developing AFib when you take omega-3s. So I certainly take them, but the people that have AFib, I recommend that they don't take them. So that's an interesting question. You just wonder if it was a fish oil tablet that may have caused that. So yeah, you just got to be careful. The one reason I'll pick that Freedom to Formulate place in Oregon to make my vitamins is because they're all domestically sourced. The raw materials just come from the United States and Europe. So, and they're tested many times over. They're quarantined and tested. And 100% of the raw materials were tested, not just 30% or 20% like they require, all of it. So, and it doesn't have fillers in it. So that's why I like them. That's why I chose them.
Yeah, I think, as we, move forward in this, you got to be, sophisticated when choosing the supplements you take. And for me, we hear the term AFib a lot, and in my head, I'm like, I don't really know what that is. Is that a heart attack?
No, AFib's an irregular heartbeat.
Oh, okay.
It means the top part of your electrical system on the top part of your heart is off, and it causes your heart to beat really fast and irregularly. So the top part of your heart, the atria, don't move to pump the blood out. It just kind of quivers. Blood clots can form in there and cause a stroke. That's why AFib patients need a blood thinner.
Oh,
That's the main complication. It's not a heart attack. It's a rhythm problem. It's pretty common.
yeah, but that's a severe consequence with the possibility of a stroke and a blood
Yeah,
clot.
it certainly is.
Richard, thank you so much for that question, and man, I'm glad.
Great question. Good to comment.
Yeah, I'm glad your friend's okay after a year. Let's get to the next question here. Let's see where I'm at. Man, these questions are great. Thank you guys so much for commenting. This is from Jay Jenkins. This is similar to the question we talked about with Spencer here, in terms of like how you would look at a cancer diagnosis. I would appreciate your thoughts on the Galleri test for detecting stage 1 cancers. I feel like I've heard of this, but I have no clue what the Galleri test is.
Yeah, there was a good article in the Wall Street Journal about the Galleri test. It's kind of the new thing. It's cancer. It's a blood test for cancer detection and early cancer detection, and it's kind of a predictor of things that you are genetically predisposed to. And so, I mean, it's worked in a lot of cases. The problem with it is, and it's not, I think it's about $1,000 to get the test. If you get a false positive, a lot of times you're going to run down, it's going to cause unnecessary worry and expense to work it up. But I think there's a lot of future use of this that's going to come out. It's not really recommended by the American Cancer Society yet, and that certainly seems to be the one that's the best. So, a lot of people will get that test and they'll do a total body MRI, and in some cases, it could save a life. But it's just kind of, those things are just now starting. So you got to weigh the risk versus the benefits and the worry.
Yeah.
But I think it is part of the future. I really do, because you want to detect cancer early. But you don't also want to be unnecessarily scared and freaked out about, what you may be predisposed to get. So, I'm okay with it though. I'm going to look into maybe offering it for some of my patients that really want it. I know a couple of radiologists that do the total body MRI. If patients want that, I've ordered a few of them. But like I say, you got to really be careful and willing to kind of, if you have a positive, get more testing and all that. But so I'm not against it.
So there could be false positives?
Yeah, there could be. They claim there's not that many, but there could be also false negatives. They miss it. So
with the type of person that would be interested in this sort of test, would that be like someone with family history, things like? Okay.
Yeah.
Yeah. I mean, as I'm listening to you, it seems like you need to know what to do with the information. You almost got to be prepared for how are you going to respond to the information, because it could.
Yeah, a lot of doctors don't like the test because it puts them in a quandary. What should I do?
Right.
No.
Well, and we've talked a lot about on this show, about the healthcare system and how so much of it is, we call CYA, that type of message, because it does put the doctor in a really, interesting position, because you almost are forced to go down a rabbit hole,
Mm-hmm. Yeah.
It's interesting. Jay Jenkins, thank you so much for putting that in there. Let's see where I'm at. I'll answer this for Evangelon. My friends make fun of me for this, and they're like, the purpose of NA beer is just ridiculous. But yeah, it's funny. I think a lot of people do drink it for the taste, but every one of my friends thinks exactly the way you're thinking, Evangelon. So I think I'm in the minority on that, but it's so funny.
So you're saying you like the taste?
I do. Yeah, I drink it. I drink the non-alcoholic for the taste and also for the routine. Like I'm a big routine guy. So
I'm like Evangelon. I don't like the taste of beer.
yeah, that's a good thing.
It's an acquired taste. It's certainly an acquired taste. I don't know anybody that likes it the first time they drink it.
No. All right, let's get to Angela's question here. I saw this come on my radar through the comments. We love methylene blue questions. Love to hear more about uses for methylene blue. It seems like there's more uses every day. How do you typically answer this question?
Well, we use it to kind of get this bluish tint to our dogs when they get into it. You've probably seen the picture.
Let me see if Angela, she'll love this. Well, if I can find it. Oh, there we go. We use it for this purpose, just to have fun.
The dogs love it,
So one of the uses is, if you want a good laugh.
We thought our dogs had cyanide poisoning. That's why we gave it to them. Just kidding. But it is in the ER. For every ER doc knows where it's at to put intravenously in somebody that has carbon monoxide poisoning or cyanide poisoning. It saves their life. It reverses methemoglobinemia, but so it increases the amount of oxygen that's delivered to the tissues. But there's so many uses of it. You probably should, go by and listen to one of the extensive podcasts I've done on it. Out of all the podcasts I've ever done, that's the one that, how many people listen to that podcast, Ben?
Yeah, that's definitely been the one that's caught the most steam. I don't have the exact number of views top of head, but it's more than all the others. That's for sure. If you look up Methylene Blue Revisited, actually both of them have gotten quite a few views. One question I get from people is, and I know we referred to it in the article around methylene blue on our website, but who's like the person who's doing a lot of the research on methylene blue? Is it a professor?
Yeah, there's a PhD biochemist down in University of Texas.
Okay.
And I forget his name too, but he's been studying methylene blue for 30 years. So he gives a great podcast about it. And we probably refer to it in our podcast, but it's just such a great compound. Again, it's been around since 1867, I think. And when they were staining genes with it, and these German scientists started looking at it under the microscope, and they noticed that it was a great stain to elucidate parts of a cell, like the nucleus, the cell wall, the organelles. So they started looking at it in that way. Then they noticed that they could identify the malarium bug with it, parasite. And they also noticed that because malaria was huge back then, killed many, many people. And then they noticed that the methylene blue, not only you could see the parasite, but it killed it. So it was the first treatment for malaria, was methylene blue, which is a precursor to hydroxychloroquine, which they used because it wouldn't stain everything blue. But it's also worked for urinary tract infections, both treatment and prevention. And we use it a lot for oxygenation. for example, we use it all the time for long COVID. We used it even in COVID, just we use it for fatigue. I tell everybody we were driving to the beach one day and I was about to fall asleep at the wheel and asked Jenny to drive, and she did. And she was same way. She was tired. We just eaten lunch. It was hot. So I asked her if she had brought the methylene blue on her vacation. She had, so we both drank methylene blue, and literally within minutes, it was like taking an Adderall pill for that situation. It just woke us right up. And so I use it for a lot of stuff: mental alertness, breathing, exercise tolerance as an antibiotic, an antifungal, antiviral, anti-parasitic drug. It's just wonderful. It's safe. And if you listen to the PhD from Texas, you won't be so worried about it interacting with, the SSRIs, or, the fact that it's a mild MAO inhibitor, or that it's a nitric oxide antagonist. So it's just an interesting compound, very safe. It will stain things, though. Our carpet was ruined when the dogs got into it.
One question that came to mind as you were talking about methylene blue, and can you take too much of it? Because it seems like something that, like, man, I could take that multiple times a day and that'd be awesome.
You probably could. We recommend 8 drops in a glass of water daily, but a lot of people, take it double that twice a day. Want to use it for cognition, because I use it a lot in dementia. Matter of fact, some people say every nursing home ought to just use it routinely to prevent UTIs and help dementia. Sometimes I'll go up to 30 drops a day. So it's very safe. But go listen to those podcasts on it and learn about it. It's cheap. It's over the counter. It's cheap. So,
Angela, I hope that helps. Great question there. Love the methylene blue questions. And I think selfishly, I just like to put up that picture of Izzy and Ike. Okay, let's keep going. I see Dave. Dave, what's up, man? Great to see you. Are there any alternatives to blood thinners for AFib, herbs, supplements? What's your thoughts?
I had a lady today that could not tolerate her AFib medications. They switched her to Pradaxa, which she didn't want to take, but she's going to try it since they gave her samples. But she could not tolerate Eliquis, I think Plavix. She just wanted to take her aspirin, which to me, if this one fails, I'm just going to tell her to take a 325 aspirin every day. But certainly aspirin. But if you want something more herbal, probably my favorite would be nattokinase. It's kind of a natural blood thinner. That's my favorite one there. Willow bark, which is aspirin. Those are some natural alternatives.
All right, Dave, I hope that helps. Let's get to, let's see, let's go to you. Let's go to Velma, then I'll get to Mark's question. Can anxiety cause blood pressure to rise extremely high? I think I've told this story before, but I went to the dentist one time and they took my blood pressure there, and it was like outrageously high. Anyways, I ended up going back to our West Knoxville office and had them check my blood pressure, and it was like completely different. So I would say yes. What's your professional opinion?
Yeah, definitely. Yeah. No doubt about it. No doubt in my mind. I've seen it many times in the office, so yeah, it can.
I think we did a common sense episode on blood pressure. And you say it's important to take this at home, like do your blood pressure at home. And I think a lot of times we only take it in these not high stress, but just, situations that could make you nervous.
And really the best way to check it is at home when you're relaxed. But there's situations where it can go up when you're in traffic or stressed out, which is a lot of life.
Yeah.
It'd be great to get 24-hour blood pressure monitors. There's just they have them out there. I've just never been able to get a hold of one to give to a patient to see what it does. Because remember, you're taking one moment in time. You know, it takes what 30 seconds to take a blood pressure. What's it doing the other
Yeah.
23 hours and 59 minutes and 30 seconds? So, you know, it'd be nice, but just measure it at different times. And, you know, if it's extremely high, like 220 over 120, there's usually something pathologic going on as well. But during a panic attack, it could definitely rise that high. I've seen it do it. Yeah, good question.
Thank you, Velma, for that question. And I'm going to get to.
And some people may, if it's really some people I'll put on a small dose of a beta blocker, which is a blood pressure medicine, heart rate reducer, but also helps anxiety. So that's something you could consider. If you take too high doses, it's going to make you tired. But anyway, it's food for thought.
What was that one?
A beta blocker.
Oh. All right, Velma, I hope that helps. We're going to get to Mark here. And this is around, let's see here. Tennessee Attorney General urges looking at Ballad Health amid concerns over Ballad fell short of charity care by $148 million over 4 years while suing thousands of patients to collect bills. Let's see, Ballad Health also failed to meet 80% of the requirements to bolster care, such as those affecting death and infection rates. How can we improve upon this corporate medicine model? You know, in your opinions, you know, let's keep it vague with the corporate medicine model. Ballad Health, of course, is in, you know, our area up in Upper East Tennessee. What's your thoughts on this?
I've got to kind of bite my tongue about Ballad because I've thought about doing a whole show on it. You know, Mark, you know, I know I don't think you don't live in this area really, so you're not affected by it, but it's horrible. Horrible. I mean, I can't tell you how bad it is. I could tell you stories that would curl your ears. So it's terrible. Hopefully they'll get bought out and somebody better will come in. But healthcare, you know, hospital care all over the country is suffering. It's not just Ballad, but they have to be, you know, one of the worst, because how else would you get singled out in USA Today, you know, a little Appalachia area like we're in, and have, you know, point out all that's gone wrong with this, the D- ratings and non-competes and, you know, everything that went on in the last 4 years. So yeah, it's horrible. You know, it just is. And I'm biting my tongue. Let's put it that way. I see a lot of doctors and nurses and patients, you know, none of them say anything positive about it. I mean, and it's horrible. It's just horrible. I have to bite my tongue a little bit because I don't want to find myself at the bottom of Boone Lake or anything. But anyway, so it is bad. You know, the way corporate medicine is going, it's all based on greed, and it's infiltrated our government, our pharmaceutical companies, the FDA, the DEA. You know, it's infiltrated it all. And so you got to really kind of be a little wary of what you believe. You saw that with COVID. That's another thing I'm going to go off on one day, is what I really think what happened. But in any event, you know, the bottom line is take care of yourself so you don't have to go down to that hospital. You know, again, you may have to, and it may save your life. So we still have good doctors around here. A lot of them are leaving, but we still have a wonderful medical community, good doctors that care. The system's tough. The system is tough. I talked to a very good friend who's an ER doc today about it. And we had a very interesting conversation about, you know, what duress they're understaffed, overcrowded. You know, and again, it's not the only hospital system having this problem.
Yeah.
It just seems for people that live around here, we're just not used to anything like that. You know, we used to have, the best hospital system, at least here in my town, Holston Valley Hospital. Back when my dad practiced as general surgeon for 40 years there. I mean, it was outstanding. I mean, nationwide is well known. And now we're well known for another reason, unfortunately.
Yeah.
But anyway, that's all I should say about it today, though. You know why?
Yeah.
Because my blood pressure is rising up. I'm getting anxious. I can feel it going up. So take care of your own health, please. And get a doctor that you can trust and will listen to you, and do everything you can to stay out of the hospital and stay healthy. Do your own research. Look into it. Talk to people. Talk to doctors and nurses that work in the system. Ask them about it if they'll open up with you about it.
And I do think that, the big message here is, and really the purpose behind this show every week is equipping yourself with the tools you need to take care of yourself. And, and also my hope is that we're, creating a whole bunch of patient advocates here with us on Tuesday nights. And hope you guys know who are with us live. There's 50 something people here with us tonight that we're for you. And so I hope you know that. And, but Mark, thank you for the question. And it's obviously a sensitive topic and, a tough thing to talk about, but, with corporate medicine, it's important to, do kind of the fundamentals well. Okay, let's go. Let's keep going. Let's see. I think Angela had one I'm missing. We're going to be here for another couple of minutes. We're going to get to all these, I think. Angela's asking, best way to lower high long-term cortisol levels. Lowering stress is not an option. Okay. So lowering stress is not an option. Need to lower long-term cortisol levels. Great question.
First thing, exercise. I love exercise for that. Getting a good night's sleep. Your cortisol levels usually high in the morning, low at night. That's the way it functions. It wakes you up, and at low levels helps you sleep along with melatonin. But, I like ashwagandha. I like L-theanine. I like the herbs. I like saffron. I use a lot of herbs to lower cortisol levels. But yeah, it's a big problem for a lot of people. But I like the herbals. I like anything. I like meditation, prayer. You need to find a way to relax. Even though you do have stress, you can learn to relax and take time for yourself. That's a wonderful question.
It is.
Great question. That's why I have my own stress formulation with ashwagandha, L-theanine, and saffron in it, all in one. That's my best-selling vitamin.
Yeah.
Is that, and then comes my multi, which is loaded. But yeah, but don't forget to exercise. Exercise is the best anxiety medication there is.
Yeah.
Exercise.
Well, Angela, thank you for asking this, because I know a lot of people feel the same way. They feel like lowering stress is not an option, and so I appreciate your honesty around that, because I know the easy answer would be to lower your stress, and a lot of times that's not
hard to do. People have to work; they have to put up with bad bosses sometimes, or have a lot of stress in their marriage or kids, and may not sleep well. That's why when you're a family doctor, you got to get to know your patients and why they're like that, and give them some helpful tips. That's why we have a psychologist on our team. That's why we have a nutritionist. We have an exercise physiologist. We have a physical therapist. It's not just here's a pill for everything. It's you gotta look at everything.
Yeah.
Angela,
thank you so much for that. We're gonna keep going here. Let's see, where am I at? I know I'm missing some. Anthony, what kind of time frame and doses would you recommend when increasing Mounjaro from 5 milligrams to 15 milligrams? My wife is loving it so far. That's awesome. What's your thoughts on this?
What I would do is go up by 2.5 milligrams every 4 weeks. So go from 5, use 5 milligrams weekly for a month, 7.5 for a month, 10, 12.5, 15. That's typical. I don't know if she's a diabetic or just doing it for weight loss, but probably she may be at least insulin resistant. Otherwise, it'd be hard to get covered. But that's kind of the way I do it. And one good point about either Ozempic or Mounjaro, especially if you're diabetic and it's just your metabolism's different, you're at least insulin resistance, you need to get to the maximum dose if you can, and stay on it.
All right, Anthony, I hope that helps. They'll put this up from my brother Steve here. Two cannibals take a couple digest shield and start eating a clown. One looks at the other and says, "This tastes funny to you." So
that's worse than my joke. That's a pretty good joke.
I love that. Huge shout out to Digest Shield and Shield Nutraceuticals. Steve, thank you so much for being with us tonight. Let's see here. I'm going to get to Evangelon. What about bromelain for blood thinning?
Some people use it for that. Some people do. It's very mild. So people use bromelain for a lot of stuff. Heart protection, weight loss. That's probably one I ought to do a podcast on someday. Try to bring up an interesting supplement that not many people know about, like HMB, and I'm getting ready to do one on glycerin.
Yep.
Which will be an interesting one.
It's funny. When I think of bromelain,
glycine, not glycerin, glycine. Excuse me, glycine, not glycerin. We could do one on that too, but I'm going to do one on glycine.
When I think of bromelain, I think of bone broth. Is that way off? Nothing to do with each other, is there?
I don't know why. I don't know why I'm not putting that together. But
I could be way off there. Evangeline, I hope that helps. Let's see. I think Spencer is asking thoughts on using THC for alternative pain medication.
I'm all for it. I think in a lot of cases, especially for chronic debilitating pain, nausea, anxiety, end of life measures, it's certainly a lot better than it's more effective and safer than opiates for sure. It keeps a lot of people off opiates. Since it's been legalized in a lot of states, you get a lot of ER docs that complain about excess ER visits from using it because you can have side effects from it, like paranoia, schizophrenia, intractable nausea and vomiting. So I think it has its good points and bad points. Certainly, if I was to use it, I would go to a pharmacist in a dispensary that can guide you on, how much and what form you need to take it in. But yeah, I think I'm not against it. I'm really not against it.
All right. Thank you, Spencer. Let's get to Fred here from Texas. I have a family member that has knee issues. Her doctor said partial knee surgery since her knee is bone on bone. Any recommendations avoiding surgery to repair? What's your thoughts on this?
Yeah. Of course, my favorite's PRP, platelet-rich plasma. Look into that. The fact that they want to do a partial means that she probably has room or some meniscus left. Otherwise, they'd be doing a total. The medial side of the meniscus wears out first usually. And there are people that do partials. Not mostly they do total, but certainly partials, if it can be done, if she's a candidate for that, it's a lot easier for rehab. But if it's bone on bone throughout, nothing may work besides a knee replacement. But they still need to develop something that's better than what they do, I think. You look at the hyaluronic acid like Synovis that they inject in there, and those are usually covered by insurances. PRP is not. But certainly I like the PRP. stem cells, which is kind of like a stem cell treatment, at least a precursor to your own stem-like cells. But the FDA doesn't really like full-on stem cells at this point, unless it comes from your own fat or your own bone marrow. And by the time you need it, your stem cells aren't going to be like that of, a newborn. So that's why if you're having a baby, bank your umbilical cord blood for uses like that in the future. Stem cells are going to be huge. They're already huge, but there's a limitation on using them right now because a lot more research needs to be done on them. But ask them about PRP. Try that. She's probably already tried the Synovisc or some of the newer hyaluronic acid products. But I like PRP. I really do. I've had both my knees injected with it. I'm not bone on bone, but it's just amazing results.
Fred, I hope that helps. I hope your family works on or gets their knees worked on. I know that's super painful. So thank you so much for that question. Doc, I think we did it. I think we got through all the questions. If I missed somebody, I apologize. We will get to that first thing next week. But man, it's been great to kind of, do this. Last week was because of the Halloween we did on Monday. It was nice to get to do this with you on Tuesday night. Man, I tell you what, how great were these questions?
They were great tonight.
I mean,
that's
man,
one of my favorites.
And I'm going to put this up from Coal Miner's Daughter just because I love this. A big patient advocate, worked in healthcare my entire life, but on privately small owned medicine side. That's super cool. Super cool.
Thank you. I like that. Here are the dogs. You want to exit with the dogs?
We're gonna.
Everybody loves to see Ike and Izzy.
There's
the blue dogs.
That is Izzy right there.
There's Izzy. She's doing great.
She's in a look how happy she is. She's such a sweet dog.
She's very happy. All right, Ike, come here.
For context, I'm gonna
buddy. Come here. Here's Ike.
There's Ike. No blue mouth, no blue tongue. He's all cleaned up.
He's having fun.
Love it.
We may go out in the backyard and run right now. I'll go run with you in a minute.
We try to close this show with the dogs. There's 47 of you here with us now. We love you so much. Thank you so much for being here with us during this hour. And it's something that I know Doc and I cherish. We really love the Performance Medicine Show and getting to do this with you guys. So thank you. Cherry, thank you for the 10. Steve, thank you for the 10. I love it. Guys, I think the dogs are gone. That means the show is we're gonna call it a show. Thank you. If you have questions for Doc or if I missed something, put them in the comments. We'll get to it next week. But until then, we'll be Tuesday, 7:00 next week. I can't wait to see you guys. Doc, AKA Dad. Dad, it's so good to see you, man.
Yeah, call me Dad. Good night, man. Thank you. Good
All right,
show.
man. Love you.
Love you too. Good night.
Love you guys. I will see y'all next week, Tuesday, 7. Looking for my outro with Brad. Love you guys. We'll see you next week.
Don't